ឈ្មោះចាក់យ៉ាងនេះខ្ញុំមានជំងឺទឹកនោមផ្អែមយ៉ាងរ៉ាំរ៉ៃដែរដើម្បីគប់គុំដើម្បីយកឲ្យគ្រូពេទ្យដើម្បីព្យាបាលជំងឺទឹកនោមផ្អែមហ្នឹងហើយនេះខ្ញុំក៏រៀបរកគ្រប់វិធីដើម្បីឲ្យទិញថ្នាំហើយឬក៏ធ្វើឲ្យជំងឺនឹងខ្ញុំជាប៉ុន្តែខ្ញុំអត់សូវមានថវិកាឬធនធានសម្រាប់ផ្គត់ផ្គង់អញ្ចឹងសូមរាជរដ្ឋាភិបាលជួយដឹងឮអំពីជំងឺទឹកនោមផ្អែមដែលជួយឧបត្ថម្ភឲ្យអ្នកកើតជំងឺទឹកនោមផ្អែមនឹងផងឲ្យដើម្បីយកចិត្តទុកដាក់អំពីជំងឺនេះផងព្រោះអីជំងឺនេះក៏វាអាចសម្រាប់មនុស្សបានដែរ
Myanmar has the poorest healthcare system in the world, followed by Cambodia in Asia. Chronic diseases, also known as the silent epidemic, threaten the health of all Cambodians. Most chronic diseases can be controlled but not cured and require lifelong treatment. The longevity of these diseases makes it important to focus on affordability of health care. According to the University of Michigan Center for Managing Chronic Diseases are long-lasting, common, costly, and preventable health problems. The World Health Organization regards chronic diseases as the major cause of premature death around the world. Heart disease, cancer, cardiovascular and respiratory diseases, diabetes, and obesity are some of the chronic diseases. According to Dr. Luces, developing countries such as Cambodia are facing double burden of disease. While their problem on communicable diseases still persists, they are burdened with the rise of chronic diseases. Hence, critical interventions have to be made to address this emerging problem. What is the root cause of chronic diseases? That's right, lifestyle. Cambodia is struggling with a growing burden of chronic diseases. In every province, 11% of the population has diabetes and 25% has hypertension. Obesity is a major cause of chronic diseases. It is becoming increasingly prevalent among Cambodians. 20% of Cambodians have high cholesterol. 80% do not have enough fruits and vegetables in their daily diet. In Cambodia, smoking is a particular problem. 2 million use tobacco, with over half of the population exposed to tobacco smoke. Many of Cambodia's poorest citizens are spending over 10% of their income on cigarettes. Chronic diseases are the major cause of death and disability in Cambodia and even worldwide. In fact, 53% of deaths in this country are due to chronic diseases. At least 16,000 children under the age of 5 die in Cambodia each year, many of which can be prevented with improved access to health care. A large part of the country's working population dies due to chronic diseases. This weakens Cambodia's productivity. So, what can the Cambodian Ministry of Health do to help those who are suffering from chronic diseases, especially those who can't afford proper medication? In Cambodia, it is unaffordable and challenging to manage chronic diseases. The country is still regarded as a low-income state. Most households cannot afford health care for chronic diseases. Total health expenditure from the government is around $30 per capita per year. Almost 90% of the total health expenditure, however, is estimated to be out of pocket. That makes it one of the least affordable healthcare regimes worldwide. Cambodian households use a combination of different sources to finance out-of-pocket health expenditure: savings, selling consumables and assets, and borrowing money. Thousands of them have incurred unpayable debts because of medical bills. Most of them avoid government-provided services because of cost and poor quality. The high cost of long-term health care and medicines, along with loss of income, pushes many Cambodian families deeper into poverty. Chronic diseases in Cambodia also lack government attention. Most diabetic and hypertensive individuals receive very limited medication. Cambodia has a limited number of medical practitioners. Now, the core problem has been identified: the overwhelming spread of and unaffordable healthcare for chronic diseases in Cambodia. Much of its impact has also been shown: 53% of deaths, high child mortality rate, low income productivity rate, 90% out-of-pocket spending, and unpayable debts and poverty. The identified main causes are lifestyle and unaffordable healthcare. The sub-causes have likewise been stated. For lifestyle, smoking, drinking alcohol, poor diet, and lack of exercise. Under unaffordable healthcare, lack of government recognition, poor financing structures, and low income. It is recommended that the Ministry of Health adopt two major solutions: preventive measures and curative measures. Preventing chronic diseases is a vital investment. For the preventive measures, the government can focus on health educational programs right from an early age, use behavioral economics in dissuading smokers, invest more in research to identify risk factors, improve products' dietary content, tax cigarettes and alcohol. Regulate the availability of alcohol and cigarettes through increasing the legal age for purchasing the same and implementing strict regulations on license acquisition for selling these products. Restrict areas for smoking to rein in first-hand as well as second-hand smoke-related damage. Regulate tobacco, alcohol, and junk food advertisements. And lastly, set up early detection and diagnostic facilities. For the curative measures, the government can recognize that chronic diseases pose a serious threat. For example, in Sri Lanka, the government has finally realized the criticality of the situation, even declaring 2013 as the year of preventing chronic diseases. Second, commit to feasible and sustainable policy solutions. Like in Sri Lanka, the government aims to reduce mortality rate by 2% annually over a period of 10 years. Third, increase the number of health professionals in rural areas by providing better work incentives. Fourth, increase the availability of generic drugs and subsidize essential medicines. Again, Sri Lanka is a good example, where 16 of 32 recognized essential medicines have been the government order subsidized across the country. Fifth, set up more health and lifestyle centers and upgrade the existing ones. Sixth, reduce out-of-pocket expenses by seeking funding from NGOs and other health partners. And lastly, attract investment from private entities through tax break incentives. Cambodia's three principal sources of health spending are government, donors, and households. As per health policy practitioners, affordable healthcare is primary healthcare. Hence, the Ministry of Finance should review the distribution of government funds and the allocation for healthcare primarily. When asked about how a poor country can achieve affordable healthcare, they believe that it is all about dividing the pie. Whatever is most suitable slice of economic growth for healthcare must be allocated for healthcare. At present, these donors focus on diseases other than chronic diseases, such as fertility, family planning, maternal, child health, and HIV. The government should strengthen its ties with these donors and suggest a shift in interest. Private enterprises can be steered towards CSR spending on health as a means of paying for their externalities costs. Governments can focus on the idea of shared value to encourage private enterprises to improve public health and gain soft benefits such as reputation management. For example, in India, CSR spending set at 2% has been made mandatory for high-profit companies. Implementing the same in Cambodia would aid the government in the form of consistent funding. The government can also incentivize foreign investment in the public health sector by offering tax benefits. Health policy experts note that for a developing country to ultimately achieve affordable health care, it needs to develop economically first. With a bigger pie, the healthcare sector will then be given a bigger slice. The government should remember that distribution has to benefit everyone. Invest in affordable healthcare for chronic diseases before it's too late.